Hello guys, my name is Lyman, a Sapon, a student nurse of Isabel State University, Section 2B. Today I will do a written demonstration about Leopold's maneuver. Before going to the procedure, provide the patient's privacy and identify the name of the patient and the date of birth. Before going to the procedure, explain first the procedure and instruct the woman to empty her bladder. Explanation reduces anxiety and enhances cooperation. An empty bladder promotes comfort and allows for more productive palpation because fetal contour will not be observed by distended bladder. Morning ma'am, today I will do a Leopold's maneuver na kung saan hawakan ko po ang inyong tiyan ma'am para ma-identify po ang position ng inyong baby. Okay lang po ba sa inyo ma'am?
Okay, that's fine.
Okay po, thank you. After explaining the procedure to the patient, wash your hands using warm water and make sure hands are warm before coming in contact with client's abdomens. Use palm of the hands instead of fingers during maneuvers. Hand washing prevents the spread of possible infection. Using warm water aids in patient comfort and prevent tightening of abdominal muscles during palpation. Warm hands prevents uterine contractions. And next, position the woman supine with knees slightly flexed, dorsal recumbent. Place a small pillow or rolled towel under her left side, draped adequately. And next, observe the woman's abdomen as to which is the longest diameter and where the fetal movement is apparent. The longest diameter is the length of the fetus. The location of activity most likely reflects the position of the feet. Okay, I will observe. Place a pillow or rolled towel in the plate in the left side of the patient. Today, I will be performing the 4 maneuvers. The first, second, and 3 maneuvers, the nurse should stand facing the body of the patient and facing the feet during the last maneuver. The first maneuver, or the fundal grip. The purpose of this maneuver is to determine the fetal part lying in the fundus and to determine fetal position. Stand at the side of the bed facing the client. Warm hands and feel upper abdomen fundus with tips of both hands. I will warm first our hands, then position the hands with this. Head is more firm, hard, and round that moves independently of the body. Breech is less well defined that moves only in conjunction with the body. The second maneuver is the umbilical grip. The purpose of this maneuver is to identify the location of the fetal back and to determine the position of the baby. And we will do the procedure. Still standing at the side of the bed facing the client, place the palm surfaces of both hands either side of the abdomen. We will do the procedure. First, the right hand remains steady on the side of the abdomen, and the left hand explores the right side of the woman's uterus. By moving from top to the lower segment of the uterus to feel the fetal back and the small fetal parts. This then repeated using the opposite sides and hands, and use gentle but deep pressure. And the right also will explore the another side. The lateral side of the fundus are palpated to determine the position of the fetal back and the small parts. The fetal spine will palpate as firm, flat, and linear. The fetal extremities are palpable by their varying contour and movements. The purpose of this maneuver is to determine whether the fetal back is left or right. And the next is the third maneuvers, or the pollix grip. The purpose of this maneuver is to determine the engagement of presenting part and estimate fetal station and to determine presentation. Okay, the same in 1 and 2 maneuvers. Stand at the side of the patient facing the client. Gently grabs the lower portion of the abdomen and just above this symphysis pubis, between the thumb and the 2 fingers of one hand and presenting together. Just like this. And then grabs the stomach of the patient. The presenting part is engaged if it's not movable. If it's not yet engaged, it is still movable. If it is firm, it must be the head. If it is soft, it could be breech presentation. Okay? The fourth maneuver, or the pelvic grip. The purpose is to determine the degree of flexion of fetal head and to determine attitude or habitus. The nurse or student faces the client feet and place the tips of her 3 finger at the abdomen above. Okay? The inguinal ligaments then presses her finger downward and inward. Like this. If cephalic prominence or brow of the baby is on the same side of the small fetal parts, the head is flexed. If cephalic prominence is on the same side of the fetal back, the head is extended. Good attitude if brow correspond to the side second maneuver that contain the elbows and knees. And poor attitude if examining fingers will meet an obstruction on the same side of the fetal back and hyperextended head. And also palpates infant's interposterior position if brow is very easily palpated. Fetus is at the posterior position, occiput pointing towards woman's back. Okay, it's done. We will now cover the patient's stomach. We're done in getting the patient's heart rate and the pulse rate of the patient and the baby of the patient. Okay, thank you, ma'am.
Thank you.
And that's my video, how to do the Leopold's maneuver.